Radiological signs in terms of the obstetrics. So firstly, we are looking at the bagel sign. Bagel sign is seen in terms of the USG. It is nothing but the unruptured tubal ectopic pregnancy. Tubal ectopic pregnancy. Okay, it is also known as the tubal ring sign and also the blob sign. Next, it also refers to the appearance of the anechoic gestational sac in the adnexa, and it is surrounded by the hyperechoic ring. So the bagel sign is the unruptured tubal ectopic pregnancy. Next, we are looking at the twin peak sign, also known as the lambda sign. Twin peak sign or the lambda sign, where it is seen in the USG. The chronicity of the plasma, it is diagnosed at 13 weeks of gestation. And what is seen is in case of the dichorionic twins. In terms of the dichorionic twins, there's a thick triangular projection. And this projection is of the placental tissue. The placental tissue and between the gestational sac. This is also known as the twin peak sign, is also known as the lambda sign or the twin peak sign. Next, we are going to look at the T sign. T sign is seen commonly in case of the MDG. What is MDG? It is seen in case of monochorionic diamniotic gestation, and it is basically a thin. It is and it is T-shaped because there is no extension. It is T-shaped. Why is it T-shaped? Because there is no extension. Why there is no extension? There is no extension of the placental tissue or the chorion. This is in between the amniotic membrane. Next, we are going to look at the double decidual sign sac. Double decidual sac sign. The double decidual sac sign, it is seen in early intrauterine pregnancy. Okay, as the two concentric echoic rings are seen in the gestational sac. Two concentric echoic rings are seen. Next, we are going to look at lemon sign. Lemon sign is at the level of the lateral ventricle. There is an inward bowing or scalloping of the frontal bones. Okay, it is the frontal bones and gives rise to the lemon sign. And what it indicates is nothing but it is the spina bifida. And it is characteristically associated with the Chiari 2 malformation. Next, we are looking at the banana sign. The banana sign, it is nothing but the anterior curvature of the cerebellum. What is it? The anterior curvature. And this is with the effacement of the cisterna magna. And this is in the posterior fossa. This is seen as the banana sign. Next, we are looking at the Spalding sign. In terms of Spalding sign, It is usually appears 7 days. This is after the intrauterine death, and it causes the liquefaction of the brain matter. Liquefaction of the brain matter, as well as the softening. This is of the ligamentous structure supporting the vault, and this leads to the irregular overlap. This is of the cranial bones on one another. Next, the very important, the frog eye sign. The frog eye sign, this is seen in anencephaly, and this is basically due to the absence. There is absence of what? Absence of the calvaria, as well as the orbits. They appear more prominent. This is also known as the frog eye sign. Next, looking at the omphalocele. Omphalocele, in terms of USG, it is a congenital midline abdominal wall defect. Basically, it is a defect of the abdominal wall, and this is at the base of the umbilical cord insertion. And there is also herniation of the solid content. There is herniation. The extruded abdominal content are covered in the sac. Next, we are looking at the double bubble sign. The double bubble sign, they are nothing but the dilation of the stomach. As well as the first part of the duodenum. This is basically due to the duodenal atresia. Next, the bunch of grapes. It is very characteristic. The bunch of grapes. The bunch of grapes is also known as the snowstorm appearance. Bunch of grapes and the snowstorm appearance, they are nothing but the appearance of the multiple cystic spaces or the lesions of complete mole. Then we are looking at the ball sign. What is it? The ball sign. The ball sign is seen in terms of the X-ray, and it is nothing but the crumbled spine, and the fetus is seen in case of the IUD, intrauterine death. Now we are looking at the Robert sign. This is seen in terms of the X-ray. The presence of a gas in the fetal great vessels. So there is gas where in the fetal great vessels, and this is in case of the intrauterine death. Next, we are looking at the stuck twin sign. In terms of stuck twin sign, it is a smaller twin is held fixed position. So what we are seeing is a smaller twin is fixed position along the uterine wall, and this is due to the oligohydramnios, and this is seen with the twin transfusion syndrome. And now lastly, we are looking at few more signs. The butterfly sign. Butterfly sign is seen in terms of the USG. It is nothing but there is presence of normal appearance of what? Of the choroid plexus, and this is on the axial imaging of the fetal brain, and there's an absence of the sign, it suggests the or the butterfly, it suggests the holoprosencephaly. Next, we are going to look at the clover leaf skull. The clover leaf skull is seen in the craniosynostosis. Lastly, we are going to look at the empty amnion sign. This is seen in terms of the USG. It is a visualization of the amniotic sac without sac is seen. This is without the concomitant visualization of the embryo, and it is an indicator of the pregnancy failure.